Okay, this is Marlena Buchanan with the nursing program at Henderson Community College. Today, we will demonstrate Foley catheter on a male and on a female. And when you anchor one, that's considered an indwelling urinary catheter. So I'm going to verify my order. It says to anchor this on Miss Daniel, and I've got her MR number, and I've got my washcloth and my gloves. Go in, introduce myself. I've ID'd her my patient. Can you state your name and your date of birth, and her MR matches? Do you have any allergies to iodine, betadine, seafood, shellfish, or tape, or any type of allergy? And she says no. Have you ever had a catheter before? She says no. So you explain to her that she's not been able to urinate for about 8 hours. Her bladder is distended, and we will put a tube in and drain it and then anchor it to bedside drainage until she's able to urinate on her own. Do you understand this? And she says yes. So next, make sure you have your bed up to working height, and I do. Put your gloves on because you need to do good peri-care. Got a washcloth. Okay. And while you're here, you're going to wipe down away from you with one part of your washcloth, down this side with the other part, and down the middle. And then take your hand and go inside the labia and spread apart where you expose the meatus and pull up, and you'll see the urinary meatus, so you know how to locate it. Thank you, ma'am. I will be right back with my equipment. Cover her back up. Dispose of your gloves in the trash. Washcloth in the linen cart. Wash your hands and exit the room. I need to get a Foley catheter tray and a bath blanket. Hello, ma'am. I'm back. Identify your client. You want to keep her warm, so put her bath blanket on her. Are you in any discomfort? She says no. Let me know if you are, and I'll stop. Pull your sheet up. Put her in the lithotomy position. And she's not real cooperative today, so we'll do the best we can. Okay. Go ahead and open your kit, pull it out, and place it on the bed between the patient. This is your disposal bag, so fold it down, make a lip, put your hand inside it and punch it so it'll stand up good and not tip over and contaminate your field. Alright, that's good. Okay. Well, ma'am, we're going to go ahead and do this. So you grab this 1-inch edge away from you, to the side, and then down. And there's your sterile field, and it's flat. And you're going to pick up your drape by the corner, up and out. Then you're going to drop it, like that. Then you can reach up under and grasp just the edge. There we go. Then you can have your instructor the day of the skill be on the other side, and she can bring the other side under the patient's leg, because ordinarily she could lift her hips for you. There, we have a nice sterile field, and I'm keeping my field in the view of my eyes at all times. Now you're going to get in and get your gloves, get out. Go ahead and put your gloves on as you know how to do. Okay, put them on your dominant hand first. Okay, hitchhiker thumb. Get your fingers inside the, edge of the, there we go. Those are packaged backwards, but it's okay. Pull down without touching your skin. Oh, now we're done with that. So move that out of your way. We don't need the fenestrate drape, so we can discard that. Go ahead and separate your kit. You can go ahead and take your 3 swabs out. Now if you had cotton balls, you would tear open your betadine and just pour it on there. Pitch that. Go ahead and get your specimen bottle out of the way. You don't need that. Go ahead and get your lubricant. Tear it. Squirt it down the inside of the tray. Come out, come around and drop it. Now you're ready to take your sheath off of your Foley catheter. You can do that inside the bag. in the box, I mean. Come out, drop it. Now you're ready to check the integrity of your balloon. So you'll take it right here, connect it, and make sure it's tight so it doesn't fly off on you. You can hold the tip of the tubing in the box and watch it inflate. Go ahead and put all 10 cc's in.
Can you hold that up just a little? There you go.
There you go. And then you want to back up on your syringe and withdraw the saline out till it collapses and your tube is flat and ready to be lubricated and inserted into the urinary meatus. Okay? Next, you want to put your lubricant on there, and you can put it back in here if you're concerned that there might be a problem. And then lastly, you're going to look at your urinary bag, make sure everything's connected and it is clamped, and it is. Now you're ready to lose your hand, ma'am. You doing okay? She's fine. You're going to spread the labia. Now your right hand's contaminated. You cannot use it again. Pick up your swab. One swipe down away from you. Come out, around, drop it. One swab down this side. Come out, around, drop it. This is cold, ma'am. And then one swab down the middle, back, around, and drop it. Now you can choose to move this tray out of your way if you would like, and scoot this one up. And you're ready to put your catheter in. You want to be back at least 1.5 to 2 inches. And you do not want to touch the labia when you're going in. Take a slow, deep breath. Keep pushing it in. Icy urine. Advance another 2 inches. Now you can grasp the tubing so that it doesn't slide back out because you're where you need to be. Go ahead and inflate 10 cc's of water. Okay, keep a hold of your syringe and of your tubing. Come straight out till you feel a tug. I feel a tug. I'm in. Now disconnect without letting that come back out. Now you're done with the sterile part. You can take your gloves off. Discard them. You want to go ahead and come across the top. There's a secure cath in there, and this lady does have one. You're going to establish this on the top of the thigh to the lateral area. Oops. Okay. And it's got a little Velcro. Then you have to say that you're going to establish bedside drainage by anchoring it on the bed frame and not on the rail. Okay, and then the rest will be coiled up on the bed. You're going to discard your equipment in the proper receptacles. Can you raise up, ma'am, and I'll get that pad out. Okay, and then you would note your documentation that you would say that D, you had an order to anchor a Foley catheter due to urinary retention. Your action was that you anchored a 16 French Foley catheter with 10 cc normal saline inflate with no difficulty. Returned 1,000 cc's of clear amber urine. Patient tolerated procedure well. Put your bed back down in the low position. Make sure she has her call light, and she does. Make sure that she'll let you know if she has any problems with it. She should drink plenty of fluids unless it's contraindicated, and you'll be back to check on her in a little while. And wash your hands.